these interview tips of these basic medical freshers. Okay, so once you finish your graduation and take up this medical coding course from any reputed institutes like Dr. Ram's Academy, you will be given a certificate, and later on you will have to just run for these various organizations where these medical coding fresher vacancies are being available. So once you reach there, so what happens and what are the measures that you need to take to tackle those interviews? So I'm going to talk about that. Okay. Okay. First of all, you can understand that these medical coding operations are being taken by companies that are like ITS, IT enabled services. So even when you find like HCL or Cognizant, where you find these medical billing operations are still there, and they also do a small percentage of medical coding operations as well. So it all depends whether you are going to like MNCs or sometimes to smaller medical billing companies where medical coding opportunities are immensely available. So it all depends on the nature of the organizations. So what happens is, so at the time of interview, see if there is a vacancy. So you will be getting this notification from the institutes where you are studied, or maybe from your peers or the students who have also taken this curriculum along with you. Try to get a referral if possible, or if that is not a way, then it's okay, it's not a problem then. If it's have a referral, that's okay, but still it doesn't mean that only if you have a referral you'll be selected. It's not the case. Even if you have a referral, you may not be selected because your selection purely dependent on the degree of your caliber and your knowledge. Okay, so what happens is, in the first place, what you should do is like, so look out for the opportunities or the companies which offer these, opening for these freshers. Then take a resume, in the sense like you should have at least 2 copies of your resume. So what happens is, in certain companies, you will be given an application form and you will have to fill that application form. You'll have to include your educational qualification, your matriculation or your higher secondary schools or a degree where you studied and all that, your address, your percentage of marks, your entirety, your history in its entirety. You'll have to fill those application forms. Later on, what you should do is like, because sometimes in some companies, they might collect your resume and the staff might tell you to come for the next phase of interview, or that my HR people would reach out to you. So it can operate either ways. Either you'll have to surrender your resume and come back, or you'll have to fill up an application form, and then and there you'll have to be asked to wait for the HR round of the interview. It all depends. So they might also tell you that you'll have to turn up for this particular day. It depends on the nature of the company, the number of people that have been turning up for the interview. So you'll have to take into consideration all those stuff. So what happens is, once you fill the application form where you are providing your information, you will be asked to appear for an HR interview. So here you should understand one thing. Many training institutes will tell you, we will arrange the job for you, we'll give you 100% placement. They tell us like we are in contact with the HR people. But you should understand, a HR person's job is only to, collect this general information, collect your certificates, but the final verdict will be given by the medical coding manager or the team leader who is conducting an interview. It is he or she who is going to select or refuse. Okay, so when institutes tell you like, we are in tie-up with certain HR people and all that, no, that doesn't work. Because a HR is not the person who takes a final call in selecting or refusing you. It all depends on the coding manager. Okay, so what happens is, you should understand that when you are ready for this HR interview, you should go and tell this person like they will also notify you that when things really get on well, you will be notified. So first, when the HR interview is over, what you can do is like, they might ask you to appear for the next round of interview, which is your coding interview. And here you should understand, this HR interview, either it can happen on the same day, or as that of the technical round of interview, or on your HR round would be over and you would be asked to come the next day or the subsequent day, or whichever day they want to notify you. So Once you clear this HR round, in the HR round, what happens is it's pretty simple. Only generic questions are being asked regarding education qualification, and they might ask you to introduce your own self, just a piece of information of your own self. With medical coding, you should understand not much emphasis or focus is given on the HR round, because here you will be filtered only based on your technical skills. So HR round is just to assess whether you are an appropriate candidate. Where is your residence? Are you from an outstate candidate? Are you coming from the same state? Things like that. Then what happens is, so based on your performance, whether you have the certificate or not, maybe this will be verified by the HR personnel. So at the time of going for this interview, it is advisable to have your Xerox copies of your original certificates. You don't have to take your original certificates. You can have the Xerox copies of your marks and all your provisional certificate, your higher secondary and all that. Okay. Then perhaps a HR might reach out to you in the sense like, you might be scheduled for the next round of interview. At that time, what can happen is you might be given a screening test. Here, you should understand the type of testing depends on the nature of the companies again. Because certain companies might ask you to take up a test on anatomy. You'll be asked like 30 or 40 questions in anatomy or pathology or these medical terminologies, and they might give you these options. Or sometimes you can also have fill in the blanks. So it is highly expected that you learn these basic medical terminologies, the prefixes, suffixes, the roots, how do you form a compound word, the meaning of those, and another thing is like what is the causative organisms of certain common infectious diseases like malaria, leptospirosis, syphilis, HIV, AIDS, and all that. So you should have some idea about these pathogenic organisms which cause these diseases. Okay. So next is like what you can do is like, so either you might be subject to an anatomy test and then you might be asked to meet a coding manager. So it is based on your performance in these basic screening tests like anatomy. The next round of interview will be scheduled with the manager. Or in some companies, this can also happen this way, where they would be testing your ICD-10 knowledge. Because there are companies where what they do is like, once you go for the first round of interview itself, the HR might ask you to collect all these coding manuals, ICD-10, the CPT and the HCPCS, and they would provide you with a battery of tests. You might be asked to take these online tests. So in those online tests, there would be questions that you can find based on these coding guidelines. They can talk about the guidelines on AIDS. They can talk about the guideline on HIV. What is the difference? What should be the first code when a patient is presenting with an AIDS-related illness? Or what is the difference between an adverse effect and a poisoning? A case scenario could be given. Or you can be tested on this coding rules on the sepsis and septicemia and severe sepsis. Or they can ask you what are the conditions where you can assume this cause and effect relationship. Or you will be given questions on these neoplasms, testing these various types of neoplasms. So this can take place. So it all depends on the nature of the company, because what happens is the company might have, like diagnosis projects. So based on that, they might question you. Or if you are going to work in a medical billing company, there could be like multiple specialties and you will be tested on the CPT coding as well. So you will be given the scenarios, take for instance, biopsy of the ear, or if it is a biopsy of the eyelid, or if it is a skin biopsy, or if it is an ORIF, open reduction internal fracture treatment of a bone, say like, femoral fracture. So you will be given those questions and you'll be asked to select the CPT codes as well. So finally, what you need to be aware is like, it all depends according to these organizations, because we can't predict in which company what they ask. So what I would expect you, or what my suggestion would be, is to be strong with these manual which is being given by us during this basic coding curriculum. You need to learn the entire medical terminologies, prefixes, suffixes, modifiers, and abbreviations as well. Don't ignore the abbreviations part, because abbreviations have so much of knowledge. It's not just mere reading of these abbreviations. When you read these abbreviations, you should understand the meaning of each of these abbreviations, because questions can come from those scenarios as well. Not much of these modifiers will be asked, Maybe in smaller companies, you can be tested for modifiers. They can ask you about the type of CPT codes. Tell me what is an add-on code, or tell me what is a dependent code. Which modifier should not be used with this code? What is a bilateral surgery modifier code? So all these needs to be there. I don't think many companies would ask you on this global surgical package, but definitely if you have really clear the concepts of this global surgical package, definitely that gives you an edge over the other students. So what happens is, so one side we have completed this anatomy testing, the other company might ask you on this IC10CM codes where questions will be given to you, and some companies might give you the options as A, B, C and D, or some companies might not give you any option, you will have to select the codes. It will be a just fill in the blanks option. So they are just trying to check your degree of confidence. Okay, or in some companies what they will do is they can very well check your CPT knowledge as well. Do you know at least these basic chapters, which codes start with which chapters? So they can ask you, the gastrointestinal system starts with a series of codes like 40,000, 50,000, 60,000, 70,000. And they can ask you about certain coding concepts. Okay, like a separate procedure. What do you mean by a separate procedure? What do you mean by a moderate sedation? So those things can be asked if this company is focusing on procedural coding. And then there can be yet another classification where this type of interview where you can feel is like CSAT, you would be tested on your comprehension part. Say for example, a passage might be given to you, and from this passage will depict a clinical scenario where a 45-year-old patient who is presenting to the hospital or the physician's office with complaints of dyspnea and shortness of breath, and he has had a history of cigarette smoking and alcoholism abuse for the past 20 years. And he might be consuming like 4 cigarettes a day, and he has recently quit smoking for the past 3 months. And he has had a family history of carcinoma of lungs, or his mother may be diabetic, and he could also suffer from hypertension. So they can also talk about the social history of this patient, like he's a car driver and he's married and he is having like 2 kids. So all these information, something that talk about the history of the patient, and then what are the medications that he's currently taking. And then now it comes to this questions on this review of systems, like does a patient has any other symptoms apart from these breathing difficulty. Then the physician's examination would come. So under the physician examination, he might talk about these various organ systems. He can do a multi-system examination from head to foot. There could be documentation of the patient's examination. PERLA. So they can ask you like, what do you mean by PERLA? What is EVO-MI? What is a rails? What is a rhonchi? So if I say like PERLA, which system it is classified? Is it classified under an ophthalmology or in an auditory system? So you should be really thorough with this abbreviations part so that you can easily answer them. And later on, coming to this diagnosis, what is a doctor documenting the diagnosis as, and what is a management that the physician has prescribed or he has arrived at. So that would be given under the impression or under the assessment and plan section of the note. So you can be either given a SOAP note, which is subjective, objective, assessment and plan, or a HNP, which is history and a physical note. Now what happens is, after this precis or a kind of this comprehension being given, say like 20 to 25 questions can be asked, stating what is the chief complaint of the patient, how many cigarettes does he smoke per day, is he an alcoholic, or it is like what is the family history of this patient, is he having like any personal history, has he had any accidents. So all these needs to be talked about. So you should be very alert, and you should know the type of questions or the prescriptions that have been given, and questions can certainly come from this angle as well. So now so far, so this is how it goes. So you have taken up this written test, and this technical round is now you are just trying to clear it off, and then the final thing would be the interview with the manager. See, in some companies what happens is, once you clear this screening level test, this is more than enough. But some companies, you might find these training managers, or you find like team leaders or managers would come, and they would start questioning you. So you don't have to panic because you have already been subjected to a written test, a screening test, and then the HR interview. Now it's that they are just trying to ask you whether are you aware of the guidelines. Again, it depends on the companies where you go. Some companies might test you on these diabetes guidelines or anemia guidelines or reporting of these primary codes. Now imagine the patient is having a prostatic carcinoma and he is presenting for a radiotherapy. Now tell me which code will be the first. Is it the cancer code or is it the encounter for radiotherapy or chemotherapy? Which is first? That we need to know. Do you understand? Okay. Now what happens is once this is all over, so the technical part you have cleared. Now if the manager, the team leader is convinced that you have really performed well, then what you can do is like, then the HR might tell you like, we will get back to you. So the results may not be known to you. You will have to wait for some time and then they would say like the results will be, we will reach back to you. Then what you can do is like, you will have to wait until this HR person calls you back. So in case you perform well, certainly you will be given this offer letter from this particular organization, and then the HR might come back to you and they talk to you about the salary details, the certificates that you are supposed to bring and all that. So on the day, the stipulated day which the HR person tells you, you are supposed to appear there and produce all your certificates. They might ask you the original certificate so that they can validate it, or some companies might just ask you the Xerox copies. It all depends on that. And you should be aware that some companies might also put you under a contract. So that depends. I don't know if all the companies are forcing you to have a contract, because what happens, the moment you join those companies as freshers, even the organization itself is going to provide you with so much of training. They are going to give you various training, say for a period of 2 to 3 months. So you will be given the salary and then you are going to take up the training, right? So now the company is spending much on you. They are appointing trainers and they are teaching you various American rules like HIPAA rules and what are the do's and don'ts of a medical coder. You should be aware of all that. Now you are coming as a medical professional, as you are going to work in this US healthcare industry. So what happens is you really need to be aware of all that. So because of that, you have to serve some period of time to the company. Maybe you might be kept on a probation. Okay, so in that probationary period, so what happens is you will have to conduct yourself. You might have very limited leaves. It's like very limited holidays. You are not supposed to take off because you are now being subject to a rigid training module. You have to go for a rigid training module where they are going to give you a training. Okay, so what you should do is like, you have to abide by the company's norms. See if it is okay. See if the time period of contract is okay for you. It is like 1 year or whatever it is. Okay, so accordingly you can do it. And perhaps if you fail, please don't worry. You can, because there are always chances, there is always room for recruitment and employment opportunities. You can always reach out to companies. So don't worry, every interview is going to be an experience. If you are not being selected in one company, it does not matter at all. Maybe, it's like the universe has a different purpose. So what you do is like learn from what you have experienced, that's it. Attend 1 or 2 or 3 or 4 or 5 companies, don't hesitate. Because every company is going to give you an experience. It does not matter. It's not that first thing you should go and get selected. No, that is not the case. You have to go and appear for as many companies and see, that will certainly make you a wonderful coder. Okay, so I hope this session would have given you all this inputs, what is needed for to crack this interview in a best possible way. So if you have any further questions, I can also elucidate on those. And if you have any queries and clarification, please post in the comment section so that I'll get back to you. Thank you very much, and please watch our YouTube session, which is also going to be in Hindi. So I would like to let you all know that. So we are going to operate in 3 languages, Tamil, English and Hindi, so that people who can comprehend Hindi can very well understand us. Goodbye, and we'll see you in our next session.